Think of symptoms as your body's internal alarm system. It goes off to let you know that there is something going wrong on the inside of you and that your body is having a really difficult time trying to deal with it on its own. A perfect analogy is a smoke alarm. If your basement catches on fire, the smoke alarm goes off to let you know that you're in danger. At this point, you have two choices. You can either put the fire out or cut the battery wire and go back to bed. If I put my hand on the hot burner of a stove, pain is the body's way of saying, get your hand off that stove. If I fall and I sprain my ankle, pain is the body's way of saying rest. The body needs time to heal. If I get heartburn, that's the body's way of saying there's dangerous stomach acid rising up into my esophagus. And a colicky child cries excessively because they're in discomfort and they're trying to let mom know that they need help. When a patient visits my office for the very first time, the consultation almost always begins with that patient expressing to me what their primary health complaint is, or symptom. Knowing that symptom is merely the body's internal alarm system, my thinking immediately shifts to what is the underlying root cause to this person's health problem. There's a big difference between treating the symptom and correcting the underlying root cause of dis-ease. Where people often go wrong is that they see the symptom as the problem, and they begin to seek out some magical pill that they can swallow to enable them to instantly feel better. This is analogous to cutting the battery wire on the smoke alarm. Although this approach is very convenient, an overdependency on pills often leads to poor long-term health outcomes. And a perfect example of this is the opiate crisis. And it's important not to fall for many of the old ploys, which can be very convincing, but do nothing but promote an ongoing drug-dependent lifestyle. These include, oh, you're old now, you should expect to have these sorts of health issues. Or your father had it, you have it, therefore it must be genetic. Or your child just grew too fast. Or another one that I hear more and more of, you now have a chemical imbalance in your brain. Now these statements rarely actually hold water, but people fall for them because they themselves are not fully informed and therefore not empowered. So really try to listen to what your body is telling you. Do your own research. Get a second opinion. Become fully informed and keep an open mind. Remember, as much as healthcare wants to evolve to the next level, there's a lot of pressure for things to stay exactly how it is. This is the status quo.